Have you ever been walking and tripped over something only to look back and find that there wasn't anything that you stumbled upon? What you might not realize is that moments like this are more than just mere accidents. They might be a subtle sign of a deeper, potentially life-altering problem called peripheral neuropathy. Loss of balance and falls are a major concern for most peripheral neuropathy sufferers, and the consequences can have profound implications. Did you know that 95% of hip fractures are caused by falling, or that 1 out of every 5 falls leads to a serious injury or possibly death? A peripheral neuropathy sufferer can experience a wide array of symptoms from numbness, burning, tingling, sharp shooting pain, and more. But most people commonly overlook the loss of balance, and probably because it's subtle and insidious. For instance, your loss of balance might initially start as a minor stumble, but left unaddressed, it can progress into a full-blown fall, which are more than just an embarrassing moment. It can make you feel uncertain and vulnerable every time you need to take a step. In this video, I'll venture into how balance works in your body and prevents us from falling. Next, I'll cover what causes the loss of balance and who is most likely to experience falls. And you're going to want to stick with us until the end, because I'll also reveal how you can restore your balance, making falls and instability a thing of the past. Trust me, you don't want to miss this. Hello, Health Explorers. If you've been told your neuropathy is permanent, I'm here to help you achieve new levels of health you've never dreamed possible. So make sure you click on the subscribe button for up-to-date and accurate information on peripheral neuropathy and what you can do to overcome it. Also, don't forget to click on the bell to get notified as soon as we publish new content. Alrighty, let's get started. Did you know that 1 out of every 4 older adults will fall each year in the United States? About 36 million falls are reported every year, with 3 million fall victims being treated in the hospital emergency rooms. 32,000 deaths are a direct result of these falls. These statistics are reported by the Centers for Disease Control and Prevention, or the CDC. When you have peripheral neuropathy, there are many factors that may increase your risk of falling. These include impaired balance and coordination, as well as muscle weakness. So let's first talk about how balance works. Balance is the ability to remain upright and move steadily with your uneven distribution of your body's weight. Your body normally maintains balance through a complex combination of 5 systems that include input from your vision or your sight, proper input from the vestibular system or your inner ear, proprioception, which is your body's ability to sense your movements in space, and sensory input from our extremities. And finally, motor output to your eyes and your muscles. For our video today, we're going to focus on the last 3 of these systems: proprioception, sensory input, and motor output. So let's start with proprioception. What the heck is this? Proprioception is your body's ability to sense its movement and how it's positioned in space or the area around your body. With any movement of your body, there are sensory receptors, which are nerve endings that send signals to your brain when they're stimulated. And they're located in your skin, your muscles, and your joints. The sensory input helps your brain determine where your body is in space. This is the reason that we're able to move freely and quickly without consciously thinking about our environment. For instance, a healthy person with good proprioception doesn't have to look down at the floor or the ground when they walk to avoid tripping or falling. Or if they do trip over something unforeseen, they have the ability to recover and regain their balance quickly, usually without falling. Since proprioceptors play an important role in maintaining your balance and coordination and in controlling body posture, when they become damaged, it can result in impaired balance and a higher possibility for falls. We commonly see significant loss of proprioceptive function in the aging population, which is why we see an increased rate of falls in so many elderly people. So let's look at things that will impair your proprioceptive receptors. Okay, folks, this is an important list. Here are some of the most common causes of impaired proprioception. The first one, no surprise, is peripheral neuropathy. Because of the damage to the sensory or motor nerves, this affects the function of receptors that can help you maintain balance. I'll delve deeper into this in just a moment. Joint injuries like sprained ankles or knees can also affect your proprioceptors. Other injuries like herniated disc or even brain injuries can also impair your proprioception. It's important to realize that joint replacement surgeries such as hip or knee replacements will also disrupt these delicate sensors. Now, there's also many chronic illnesses and diseases that will impair your proprioceptive function, such as arthritis, diabetes, stroke, multiple sclerosis, Parkinson's disease, Huntington's disease, Alzheimer's disease or dementia, ALS, otherwise known as Lou Gehrig's disease, and autism spectrum disorder. Now, make sure you watch this video until to the end, because I'll teach you how to repair and regain proper communication of these important receptors. Now, let's move on to the next cause that can impair your balance, and that's poor sensory input. Well, to start with, let's talk about what sensory input is. Part of your nervous system is made up of sensory neurons. These are nerve cells that are activated by sensory stimuli or input from the environment. For example, if you were to touch a hot surface with your fingers, your sensory neurons will fire a message to your brain notifying you that this is a dangerous stimuli. Now your brain will respond by telling you to quickly pull your hand from the hot surface to keep you safe. Now, your feet are an important sensory structure that help you maintain postural control, which is a fancy way of saying they can help deliver information to your brain to prevent you from falling on your ass. Is it okay to say ass on this video? Is ass really a bad word? Okay, I digress. Let's get back to it. Your feet are a direct interface between your body and the ground, and they allow us to interact with our environment. So, for example, if you're walking on an uneven surface, let's say across gravel or on a grassy surface with hills or irregularities, a healthy individual can navigate this terrain without losing their balance or falling, because their feet provide information to the brain that allows the brain to make corrections in the walking pattern and allows you to compensate for that uneven surface. Now, many peripheral neuropathy sufferers will develop damage to the sensory nerves, also known as small fiber neuropathy, and this will result in decreased sensitivity to the sole of the feet, which we call numbness, or it can wipe out the proprioceptors found in the skin or the soles of the feet. Either way, there'll be a decreased and impaired communication about your environment when you're walking. This is what leads to balance issues and an increased risk of falls. Okay, but there's still another component that plays a role in balance issues, and that's motor output of your peripheral nerves. What I'm referring to is when impulses are sent from the brain to the muscles that control your eyes, your head, neck, and especially torso, and your legs and feet. When you develop damage to the motor nerves of the peripheral nervous system, this can result in muscle weakness and alterations in gait control. Now, gait refers to the pattern of limb movement when a person walks. When altered signals from the brain prevent a steady rhythmic gait or movement, this can result in poor balance and falls. For instance, if a person develops an abnormally slow gait or shows inconsistencies in their gait, maybe they begin to wobble or sway or show signs of unsteadiness. These are precipitating factors that can result in an increased incidence of falls. Now, when looking at the most common impairments that disrupt balance and coordination, proprioceptive damage and sensory impairments occur most frequently. And remember, when we're talking about sensory damage, we're referring to small fiber peripheral neuropathy. These two occur far more frequently than motor impairments. Now, maintaining your balance and coordination are critical to your health, because falls are the leading cause of injury-related death amongst adults 65 and older, according to the CDC. When we first wrote our book, Defeat Neuropathy Now in Spite of Your Doctor, the statistic posted by the CDC indicated that 87% of all fractures, including hip fractures in the elderly, are from falls. Well, 9 years later, the CDC has now reported the statistic has increased to 95%. Furthermore, statistics showed that 1 in 3 adults over the age of 50 dies within 12 months suffering from a hip fracture, Wow, you can see how imperative it is that you do everything within your power to maintain or regain your balance. Now, here's what I want you to realize. Balance issues arise very slowly. In fact, it can be so slow and subtle that you don't even realize you're losing your balance until you begin to fall repeatedly without any precipitating factors. So I'm going to show you how you can actually assess your balance. There are a few tests that you can do at home which will give you a good indication of how stable your balance is. Now, I can tell you how many patients that have walked into my office who tell me they don't have any balance issues, and once I take them through these simple and easy tests, they fail miserably, and they're shocked. Now, it's not necessarily that they were in denial, but it's because it occurs so slowly, most people don't even realize they're losing their balance. And other systems of their body begin to compensate. Like, for example, we start to use our vision, we look down, our vestibular system can compensate for the loss of balance without even realizing it. Okay, here are 3 simple tests you can do at home. But first, here's a warning. Do not perform these tests unless one of these criteria is met. You have someone to monitor you and possibly assist you while you do the test. This can potentially prevent you from suffering a dangerous or unexpected fall. Or 2, you have something to hold on to or to grab just in case you lose your balance. Or if you use a cane or a walker or any assistive device for walking, do not perform any of these tests. Okay, if you've met these criteria, here's the test you can do.
Romberg test. Make sure you have someone standing very close to you while you perform this test. To increase safety, stand close to a corner of a room where you have a wall on 2 sides of you. Remove your shoes and stand with both feet together. Place your arms by your sides or cross them in front of your body. Close your eyes and try to stand completely still for about 30 seconds. If you experience an increased sway or an inability to maintain your footing, this is an indication of disrupted balance pathways. Heel-toe walk. Stand up straight and look straight ahead. Do not look down at the floor or your feet. Place one foot directly in front of the other foot, with your front heel approximating your back toe, like you're walking a balance beam or a tightrope, but remain looking straight ahead. Take about 10 steps in one direction. Repeat the heel to toe going in the opposite direction. This is otherwise known as the drunk test. Single leg stance. If you failed either one of the first 2 tests, Romberg or heel to toe, do not attempt this next test. Keep your eyes open and place your hands on your hips. Lift your right leg off the ground and stand on one foot. Monitor how long you're able to hold this position without removing your hands from your hips or placing your right foot down. Start a second timer as soon as your right foot leaves the ground. Next, switch sides and repeat on the opposite side. With eyes open and hands on hips, raise your left foot off the ground and start the timer. Remember, the timer stops if your hands leave your hips at any point or if your foot touches the ground. If you're unable to hold the one-legged stance for at least 5 seconds, you are at a greater risk of injury from falls.
If you're able to hold it for longer than 5 seconds, you might be wondering, what is a normal time frame? Well, here's a chart that shows you how long you should be able to hold this position based on your age group. If you land within these values, then you have good balance and proprioception. What I like about this chart is that it will help you identify if you're beginning to develop any issues with your balance. Okay, now let's say you already knew you had balance issues, or through this video, you just discovered that you have the dreaded balance issues. What do? Well, here's one thing you need to know. Your balance will not automatically return back to normal, even if you repair the nerve damage and resolve all your other symptoms. In order to restore your balance, you have to reprogram your nervous system. We call this the nervous system reboot, much like rebooting your computer. Brand new neural pathways have to be reprogrammed, including your proprioceptive sensors. You need to engage in balance retraining exercises. We released a video called Exercises for Your Neuropathy. These exercises will help you reprogram your balance pathway and restore your coordination. Now, there are other exercises you can add to these. For example, you can pump your ankles before you get out of bed. Start by pulling your toes up towards the ceiling and then pointing your toes down. Now, repeat this 10 times. This will increase your circulation and will begin stimulating your receptors. You can add side-stepping exercises to your regimen. This is an advanced exercise and should only be done if you can successfully complete all the exercises on our video without difficulty. For side-stepping, step to one side with your left foot, then bring your right foot to meet your left one. Do 5 side steps to one side and then repeat back to the other direction. You'll want to do these neuropathy exercises that help with strength and balance at least 5 days per week. Now, don't worry if you can't do 5 days to start off with. You can work your way up. If you find that you struggle to do all of these exercises in our video, don't fret. We created individual videos for each exercise to allow you to start off slowly and build your way up. Remember, gang, we've been at this for over 20 years now, and we've encountered almost every obstacle imaginable, so we always have a workaround for you. Alrighty, Health Explorer, here's the last nugget of wisdom I want to share with you along this journey. Imagine life as a dance floor and peripheral neuropathy as the unexpected twist that tries to trip you up. But guess what? You've got all the right moves, and with a bit of practice, you can dance your way back into balance. If you found this information helpful, don't forget to like us and share this video with others who can benefit from it. Our goal is to form a large and strong neuropathy-free tribe around the world. So let's stay in the groove and find our balance and keep dancing to the beat of good health. Remember, it's not about the missteps, it's about bouncing back in the game of life. Until next time, my friends, I look forward to seeing you on the road to great nerve health.
Place one foot directly in front of the other foot without the dog obstructing your path.
Start over.
Yeah.
Hi, precious. Should I roll?
Just get settled for that.